also known as RFP number 2019-000043. My name is Brian Hancock. I am the purchasing agent in charge of soliciting this project. First, what we're going to do is go over what to expect during this meeting, and then at the end, I'll come back up and give you a timeline of where we're going from here. There's been several questions submitted. And just to let you know that we are looking at a couple of things. We have a couple clerical errors that we need to clear up. We're also, the biggest one is probably we're looking at the mandatory criteria. Those changes are going to be published at the same time as we publish the answers to your questions. All the information is going to go out at the same time, but I am accepting questions at this time. So if you have any questions, send them to me. You can send me multiple emails. I'm okay with that. I will collect them, and then after the deadline, I'll submit them to the program, and we'll get the answers out there as soon as possible. The structure of this meeting is we have three different main topics. Main one being the review of the budget. You want to make sure that there's a clear understanding of what we're looking for when something is submitted for the budget, so when we do evaluate, we can compare it easier. After the budget, we will have a question and answer period for the budget. You can ask clarification questions of the information that you hear today. If you have other questions about the budget, they need to be submitted for the inquiry deadline. But after Andrew gets done, he will have if you have clarification questions on what he has presented, then you can ask those questions. From there, we're going to move to a review of data submission. Again, we're going to have a question and answer period at the end of that one. We are not going to go back and answer budget questions at that time. So if you have a budget question, you have to ask it during the budget section, but we're just going to move on. If you have a budget question after we've closed the question and answer period for the budget, please submit it in the inquiry deadline. Okay, then from there, we're going to go into the programmatic review, and then I'll come back up here and review the timelines in the next step. So from there, I think Robert's going to take over, and we'll get this started. Thank you for being here.
I'm going to be real quick. I'm just going to go over the budget. Like I mentioned, we'll have our sections, but I'm just going to go over the budget, just the one slide for me.
Oh, cool. And if you could introduce yourself.
Sure. Robert Worthwine, Director of Behavioral Health. I'm just going to go over this slide, which is the allocation of funds between the regions and how we came about this. There are three components that drive the region, the funding by region. Was my population size for the region, also poverty population, so the number of folks. I think we picked 300%, if I remember correctly, which is the same as our other funding sources at OBH. So that population, and then there was a weighted factor for rural and frontier county population size, particularly trying to continue the efforts of Senate Bill 207, which really emphasized continuing to increase capacity in the rural regions and the frontier regions. You'll notice that Region 1 has a little bit more money than the other regions. There is 1.2 and change set aside, about 1.3 million that was specifically set aside in Senate Bill 207 for funding for particular areas in Region 1. And we ran our calculations with that money set aside, then we put that money back in, and that's why Region 1 is the number it is, because the 1.3 million specifically designated in Senate Bill 207 for Montrose and with some resources towards Summit County as well. So, any questions on that before I turn it over to the very technical, detailed budget pages that Andrew put over? Great, thanks.
Good afternoon, everyone. Are you ready for budget? All right.
Introduce.
I'm Andrew Martinez. I'm the budget manager for the Office of Behavioral Health Division of Community Programs. And I'm going to be presenting the budget submission workbook. Today, I'm going to start off first with a PowerPoint slide and kind of an introduction to how each of the components in the budget workbook, with purposes and some of the highlights. So to start off with the budget overview, we've kept the budget structure pretty similar to how we contract right now. We're allowing for both the capacity-based reimbursement model, which is a modified cost reimbursement that accounts for all the costs in a cost center, less revenue offsets from other payer sources. OBH's in this program is the payer of last resort, and we're looking for offers to have programs that utilize other funding sources, specifically Medicaid and other third-party payers, grants, anything to really bolster the program budget. So we'll allow for both capacity-based reimbursement, and then there'll also be the opportunity to get fee-for-service reimbursement for different types of services where maybe you don't have a full running 24/7 facility and you have some contractual services that you may want to provide that may not be on a 24-hour basis, but it's more cost-effective to do that. Okay. For the purpose of the worksheet, facility and capacity-based reimbursements are synonymous terms, so you'll see that throughout the document. And I'll walk through, at the end, I'll actually go through the workbook and we'll kind of take a little tour of what you can expect in the workbook and what you have to submit to us. Resource and fee-for-service, those are synonymous terms, and I covered that in terms of in which cases you would use that. In terms of the contract, each of the contracts will be awarded. There'll be a not to exceed amount. That's a capped amount that we're going to have. So any cost overruns will be that's a risk that each contractor will have to bear. But we will not pay for any costs above and beyond the not to exceed amount. And then also on a monthly basis, in order to manage the 24/7 capacity, we all are also going to be using monthly caps. So we'll be looking at that also. So when we get into the workbook, there's a table of contents at the beginning of the workbook, and it has all the details in terms of all the different workbooks or spreadsheets that are within the workbook. And they're labeled, they're color-coded, there's 6 color-coded sections. And then in the table of contents, there are the required number of spreadsheets that are going to have to be submitted. So that's something to pay careful attention to, because you just want to make sure that you have the entire budget package when you submit it during the bid. As I said, on the table of contents, where you're going to see areas where you're going to have to submit more than one spreadsheet, you're going to see the minimum of 1. So in these cases, if you're a region that may have multiple teams or multiple facilities, you're going to have to submit a set of spreadsheets for each facility or team. And I'll go into more detail as to how all this works. So I'm not sure if folks in the room can see this, but here's the hierarchy of how the budget is put together. First, we're going to start off with a crisis budget by modality. That's a summary spreadsheet that basically all the other spreadsheets, all the other modalities will feed into the spreadsheet, and it'll total up all the costs on that. Okay. And we'll go through, and there's a section for, we'll have master ASO, mobile, crisis stabilization, master walk-in, and master respite. Okay. We've already covered that in terms of the crisis services budget by modality. That's going to be the roll-up spreadsheet. Administrative service organization. This will be the managing entity of all the services. And one of the things in this spreadsheet, and I'll walk you through it, it'll show you exactly which are the minimum positions that should be staffed in the as part of the ASO entity. indirect costs are capped at 15% of the total ASO budget. So that's something to keep in mind. It's not an absolute that you bid up, everybody bids 15%. That will also be evaluated during the evaluation process. So that's something to keep in mind. Part of the budget, we're looking at, cost effectiveness and where do we want to have in terms of the budget. So
You just point out the B1 to B3 corresponds
right.
to the spreadsheet.
Exactly. So don't know if you heard the question. So at the top of the PowerPoint, we have sections B1 to B3. Those are going to be the spreadsheet sections that we'll go over during the in the workbook. And each section, each spreadsheet basically has a number assigned to it, a letter and a number assigned. Okay. So that's the hierarchy for the master ASO budget. You're going to have the budget that is fed by a personnel detail spreadsheet, and that's going to capture basically employee costs. The ASO operating detail is going to cover all the other costs. One thing to point out, if you have any contractors, there's a contractor area in this spreadsheet that I'll go over. So the mobile section of the budget, we have a master budget that accounts for multiple mobile teams. So you'll see specific columns for each team, and there will be, we're asking that you put in the counties or the areas covered by each of the mobile teams in the spreadsheet so that we can have a connection between what is, which areas of the state that each team is covering. Here's a look at the hierarchy. As I said here, with the mobile team, the personnel and the operating detail, if you have multiple teams, you'll have to submit a spreadsheet, a set of spreadsheets for each team, both personnel and operating. Crisis stabilization. So in this area, there's a specific spreadsheet that has beds that you're going to propose in terms of guaranteed beds, and we have specific designation of the types of licensing, and we'll walk through that when we go through the workbook presentation. Again, if you have, you can do both capacity-based and fee-for-service in this area. There's the hierarchy of the budget. Walk-in center, it's the same concept. Multiple facilities. You'll have columns for each of those facilities to fill out in the master budget. And you will have the accompanying personnel and operating detail spreadsheets to accompany that. Hierarchy. Respite, same thing. And then I will go through some of the specifics on respite in terms of how you may structure in terms of some folks may have per diem based respite care, or they may have hourly based respite care, and I'll show you exactly where to put that in the budget. Okay. So I'm going to switch over to the spreadsheet. Chris, I'm going to need to make sure I don't balance up.
And then we just have to talk about the row and column. Is that loud?
Yeah, sure. Can everybody see this, or does it need to be enlarged?
Can't see it.
Well, part of it is. Okay. So we'll start with a table of contents. Can everybody on the phone hear me?
They're not allowed.
So right here in the cell B13, this is the start of the areas that you'll have to fill in. So you're going to put in the region number that you're bidding on, of course, your offer name, and then that will be consistent throughout the workbook. You'll have to put that information in. Want to make sure we have that in there. It's very important because there's a lot of information. We just want to make sure that none of your budget proposal gets lost. So that's the way we're going to make sure that it stays together. Starting in row 20, that is where all of the instructions start for each of the budget components that we just went through. So the A1 is going to be the crisis services budget by modality. And then in column C, there's instructions that talks you through how to link up all the different spreadsheets that are in the workbook in terms of linking up the, all of the master sheets will link up to that spreadsheet because it's a summary spreadsheet. So it'll walk you through that. In column D, it describes the number of spreadsheets that are required in the budget package. And I'm just going to kind of scroll through so you can see what it looks like in the instructions. Okay. So going into the crisis services by modality, in column D, row 21 is where you're going to link up your master spreadsheets from the other other sections of the workbook, and they're color coded. So if you can see down here, we have colors. This is the master. The ASO section is in purple. So they're all color coded so that you can trace them back to which section goes with which. I'm going to move on to the master ASO. In row 31, that's where we talked about the cap. In row 21, that's where the instructions are to tell you to link up to the ASO personnel detail tab. That's right here. The other line items says the ASO operating detail. Here are the tabs that are in here. You can see at the bottom of the scroll bar, I'm highlighting the ASO operating detail. So that starts in row 22 through 27. In row 31, D31, we talk about the need to justify the indirect cost. So as part of your budget submission, we want a narrative because you're going to have evaluators looking at this. As much as you can describe about what is going into the budget, the better they're able to evaluate what you've submitted. Personnel detail. And these spreadsheets, the format is very similar. So once you get the hang of personnel and the operating detail, all of the categories of expense, they follow the ANA guidelines, so they should look familiar to most of your financial folks. In the ASO personnel detail, in row 11, column B12, we've put in the different positions that are required in the RFP. We've pre-populated that for you. In column I is where you'll describe, these positions and how they function and what your justification is for each one of those positions in there. The operating detail spreadsheet follows the ANA guideline cost categories. In the ASO, we put an example in here that for contractual services you may have, and this is just an example. You'll have to decide how you want to, how you structure your ASO, but this may be an area where you would have contractual costs on an hourly basis. This is where you would put it, not in the personnel area, but right here in the contractual services area. Moving on to the green section, the master mobile budget. We talked earlier about the different columns for teams, starting in column D, E, F, and G. This is where we have the specific team budgets that you will accumulate and link up with this spreadsheet. Each of the team budgets will have to have personnel and operating spreadsheet along with this budget. This budget is the mobile team budget. Go ahead. Yeah.
So I was just going to give an example here. I think at the meeting we had several weeks ago, there were some examples of law enforcement and different emergency medical systems that have been stood up in different communities. And this is a way to start thinking about how do you leverage those existing investments with partnerships with law enforcement. We have many grants that we had put out recently for co-responder grants. So this is a way to think about leveraging existing infrastructure within your communities. And so each of those sort of investments that the administrative entity might be paying some investment will need to be reflected in these different columns for each team that you're describing. And so make sure that you describe what that team looks like and who comprises that team.
Okay. So again, these spreadsheets have in column D instructions on how to link up the subsidiary workbooks, or spreadsheets. Sorry about that. Personnel, mobile team personnel. The format again is very similar to the others. This is where you'll put in specifically for each team the personnel costs involved with that specific team. Mobile team operating and resources. You'll prepare a spreadsheet for each team on this one. And let me scroll through to see if there's anything there in terms of specialty instructions. Moving on to crisis stabilization bed capacity. This is the spreadsheet that I referred to earlier that talks about, and I'm going to scroll over here to the right, that talks about the facility or resource that you're using for crisis stabilization. So we have the different types of types. We have a community clinic, we have ATU, RCCF, and then other. And we've included service options in here in terms of their capacity to use seclusion and restraint, locked doors, and emergency medications. In this area, we're asking for offerers to give us in columns I, J, and K the number of annualized beds that you will propose to us, and those that are covered by PICPUP and those that would be covered by OBH. So the ones that would be covered by OBH would be, they're labeled as number 1, and the ones that are would be covered by Medicaid, PICPUP would be number 2. So those are rows J and K respectively in the workbook. Okay, moving on. Master Crisis Stabilization Budget. This will be the summary budget for the crisis stabilization. And this is where you're going to accumulate each of your facilities or the resources. Again, we use the resource if you're going to contract out for maybe a service that's not going to be available, 24/7, and you're not funding it based upon capacity level budgeting. So the crisis stabilization facility budget, this will be fed by both the personnel and the operating budget, and you'll do this for each facility that you're going to fund based upon a, either capacity or fee-for-service basis. If you're going to do a fee-for-service basis type of facility, you would fill out this spreadsheet and link it to crisis stabilization operating. And in row 22 of this spreadsheet, we've given an example of what that would look like in terms of cost per day, number of days, and then that would roll back, to that resource. Okay. We're almost there. I know this is a lot of budget. Thank you for your patience. Master budget walk-in. So again, same concept. This is going to have specific facilities and then also resources. So if you ever need to, if we didn't provide enough room, you would go through and to these spreadsheets, you can go ahead and add in additional columns if there isn't enough room already provided. But then you also need to add in all the corresponding spreadsheets that would comprise of a team or a facility. Okay, so we try to provide enough room in here in terms of the number. In this case, we have basically four options or four facilities, two facilities and two resources. But if you need to relabel those, of course, you can do that and structure it the way that you're going to put, that fits your bid. Okay. Again, for walk-in facility, there's the accumulation spreadsheet here that'll accumulate both the personal services and the operating detail. Moving on to respite, very similar to walk-in, you have either facility and resource. And this may be a case where some folks may choose to do it on a per diem basis or hourly basis, depending on what model of respite they want to offer. Again, here's the facility budget that's going to link up with the personnel detail and the operating resources. And this specific spreadsheet for the operating resource detail for respite shows an example of what it could look like for a hourly type of pricing structure for respite. That would be in row 21 of this spreadsheet. So I think that's it in terms of the budget workbook.
Does anybody have any questions on what they heard today on the budget?
Really?
Let's give the people online a few minutes to type in their questions.
Absolutely.
We've got one question.
All right.
Hold on a second. The first question is, what happens when 2 or more ASOs or regions are applying to use the same CSU services? So, for example, if there's 12 beds and they're in an area that overlaps, how do we address the budget for those two? Does this make sense to anybody?
Yeah. So, yeah, I think that one's gonna.
So we're going to default that question. Can you submit that during the written inquiry period? Because that's going to take further investigation. It's really not a clarification on the budget template itself, more of a how do I submit this type question with the RFP language. So I'd have to have that submitted for the written inquiries, please.
I have another one. Thank you for sharing the region by region state funding breakout. What has been the equivalent run rate for Medicaid billing associated with these contracts and services? And how does that experience compare with the proposed plans for additional Medicaid billing presented by successful bidders of the last 5 years?
Again, I'm going to default that one to the written inquiry period. It's really not a question on the information presented about the template. It's very specific about what type of information goes into it, and we'll need to make sure that we answer properly. So if you could submit that as a written inquiry as well, I would appreciate it.
This maybe we could answer. How will the budget for each region be distributed out by each modality?
How will it be distributed out by?
So are there limits on, I'm assuming that this means, are there limits on how many dollars you can spend for each different modality that are expected, or is it just the total amount that we're giving them for?
I think we said that we were, in terms of the mobile, you want to say something about?
I think you say to the total ASO and then how that's distributed, but we did, yeah.
Yeah, so there are some preferences that we're going to look at in terms of prioritizing mobile. There isn't a specific dollar amount, so it's up to the ASO in terms of how they write the proposal and budget the proposal. But that is one of the things that we have in the RFP that says that we are looking at the prioritization of mobile. So it'll be up to the offerer to, justify their position.
Thank you. Are there any more questions, Kristen?
Not that I can see right now.
All right, from here, we're going to move on to the data submission requirements. So if you have any further questions about the budget, please submit them to me by Friday, close of business, and we will include those during our written inquiry period. Move on, data submission requirements. Camille's going to come up here and talk to you guys about some clarification on that. Thank you.
Camille Harding, Division Director for Community Behavioral Health, Office of Behavioral Health. So I'm just going to review the data submission requirements. If there's specific questions, we can get to that. So there's a table in the RFP that outlines all the required deliverables and what interval those deliverables are required. In terms of the administrative entity, they are responsible for collecting a minimum data set. So that will include the client level demographic data that will likely come through the data integration initiative, which is the H4T module. And that module at minimum is going to require the name, date of birth, veteran status, gender, and Medicaid ID, and the service be submitted for all modalities. And then secondarily, for any claims that are submitted, we will require that those 837 files come to the Office of Behavioral Health, so we have a complete data set on utilization within each modality. So this diagram that you're all seeing, so we have some flexibility about the way that the data comes to us. So the data can either be submitted through the H4T directly to the Office of Behavioral Health via the portal or in batch files, which will be specified in the specifications for the DII. Or there is also the opportunity, depending on the the bidding entity, the ASO could submit on behalf of whoever comprises that set of providers within the administrative region. And then also, we've had some conversations about health information exchange and what data sets can be submitted via HIE, and that could be submitted via HIE, then submitted to OBH via the HIE. So those are your different options. The option about the HIE is that it leverages existing data that's housed within health information exchanges, so admit discharge transfers for folks that have used any inpatient, emergency room, labs, and so there's other data contained within the HIE that may be important to think about leveraging within a region. So that's why HIE is listed up here. Let's see if there's any other. And then additionally, there is a monthly complaint report that will be required to be submitted to the Office of Behavioral Health by the ASO, so that we have a complete set of information regarding complaints. There is an annual performance outcome report. And then there are also performance measures that will be submitted by each modality, which are usually percent of utilization, percent of individuals who were screened for suicide risk, and then those folks that have a telephonic follow-up, and then those folks that also were connected to ongoing treatment services. So those are some across the board. You can read through the table within the RFP that specifies each of the required mandatory clinical outcomes. And then let's see if there's any other high level. And then annually, each region is required to submit a performance outcome plan and outline what your clinical priorities and plans are for the region. Oh, and then this last slide is really a summary of what was presented in our previous, before the RFP was released, but it's expanded requirements for technology and infrastructure to ensure that we have complete encounter data, participation with health information exchanges, monthly administrative reporting that includes average daily census and bed capacity, and then this enhances our ability to follow folks across different points of utilization within the system. And then we are requiring the number of referral requests and mobile dispatches.
All right, thank you, Camille. Does the room or online have any questions in regards to the program or the data submissions? We'll give online a second to type up their questions if they have any. We good, Kristen? Don't have any? All right, we're going to move on. I'm going to skip over the program questions because I think most of those are going to have to be in the written inquiry. As soon as you start talking about scope of work or time frame or RFP guidelines and rules, we want those written down so we can uniformly answer them and provide them to everybody at the same time. So speaking of that, what are the next steps? We have a written inquiry deadline coming up Friday. You can email me your questions. Again, if you've already submitted questions and you have received more or you get more, feel free to submit to me multiple emails. I will gather those up and send them to the program after the deadline, and we will get those answered. I will not be accepting any questions after that date. I will ask you to use your professional judgment and based off the guidelines that we provided within the solicitation to come up with a proper offer for us. I'm hoping to get the written inquiry posted before the 5th. That way it provides everybody who wants to submit a bid at least a month to finalize their offer and get it to me on time. This recording is going to be published it's going to be posted on Wednesday. And so I will be updating the DSS website with this presentation. We're also going to include the link on this presentation so you can go back and hear the audio of Andrew. Just in case you didn't take good enough notes.
Yeah.
From there, we have a proposal submission deadline of 12 p.m. noon, 11/5/2018. Please read, be aware that it needs to be in my hands by noon, or there is a chance it will not be accepted. If you have any questions or comments about this RFP, please contact myself. My name's all over the advertisements, but it's brian.hancock@state.co.us. If you have any questions, crisis related, that is not crisis services, that is about this RFP, you can contact Christopher over here, such as if you have questions about the hotline or anything else that you may want to ask him. And then if you're not signed up for the OBH newsletter, please contact Liz Owens. There's lots of good information going out there with that all the time, so it'd be nice probably to be a part of if you're in that type of work. Does anybody have any RFP process questions that I can answer? Excellent. I look forward to receiving your questions. And that's about it.
Thanks, Brian.
Thank you.
Thank you.